Hello, I'm Aimen Amer, and I want to spend the next few minutes talking about groin hernias. The reason I wanted to talk about groin hernias is that they affect many people, particularly men. In fact, 1 in 4 men will develop a groin hernia in their lifetime. The commonest sign of a groin hernia is as a swelling or a lump, and it is often this noticeable bulge that prompts a person to go and seek medical advice. Now, hernia lumps can range from being barely noticeable to being very, very large and getting in the way of day-to-day activities. A hernia lump can appear when an individual stands up or coughs and then disappear when they either push them back in or even sometimes when they lie flat. Occasionally, hernias can be out most of the time or all the time and can be difficult to push back in, sometimes impossible to. The other symptom that a hernia can cause is pain or an abnormal sensation in the groin, such as a dragging feeling or just a general feeling of discomfort. Many sensory nerves cross along the groin, and it's therefore no surprise that irritating these nerves by a hernia can cause all these sensory symptoms. A person can present with these abnormal sensations in the groin either with or without a lump. If an individual presents without a lump and a doctor can't feel a hernia on clinical examination, that is known as an occult hernia, and your doctor might request additional scans to confirm the diagnosis. Occasionally, a hernia in the groin might go unnoticed if it presents with no symptoms at all. These hernias are usually detected on a scan performed for a completely unrelated reason, and this is known as an incidental hernia. It's important to mention that although uncommon, sometimes the bowel inside a hernia can twist or lose its blood supply, and that presents as a medical emergency with symptoms like pain or symptoms of bowel obstruction like vomiting or swelling of the stomach. This complication happens in about 1 in 100 of patients with a groin hernia, and it's more likely to happen in those hernias that are large in size or difficult to push back in. So to summarize, groin hernias can present as a visible swelling or as pain or an abnormal sensation in the groin, but sometimes a groin hernia can present with no symptoms at all and be detected incidentally when you're looking for something else on a scan. Bear in mind that whilst uncommon, hernias can cause bowel complications which require emergency treatment, so early assessment is important. Regardless of how a hernia presents or is diagnosed, it is important to have it checked by a specialist who can guide you on the next steps of management.